So this is a very versatile machine. So would you say in your practice, do you have any machine that is more versatile than this?
Definitely, like before, I think vascular laser was our number one thing by far, and I suppose that was safety, convenience, and also that. But I think actually now with new technologies, the ablative lasers just have that power to really repair the skin and normalise. And I think fractionation really was transformative in the laser world.
Halo, salam kenal. Kita lagi ada di Bali, kita lagi ada mau ngadain podcast. Saya dengan Dr. Andrew dan ini bersama dengan Dr. John Sullivan. Dr. John Sullivan is a dermatologist from Sydney, Australia. I couldn't imagine being in a better place rather than in Bali doing the podcast with such an amazing people. Let me please introduce Dr. John Sullivan. So Dr. John Sullivan is, I'm going to read out his CV now. So, Dr. John Sullivan specializes in laser and cosmetic dermatology, as well as general dermatology and skin cancer and melasma treatment. Dr. John is also a senior lecturer at the University of New South Wales Clinical School and operates at Carina Private and Ramsay Surgical Center. And Dr. John is also a very respected member of the Australasian Society of Cosmetic Dermatology, member of American Society for Laser Medicine and Surgery, European Academy of Dermatology, and is also involved in a lot of clinical research and advisory reports globally. Please welcome Dr. John Sullivan. Hi, Dr. John. How are you?
Thank you very much. And it's, as I said, it's beautiful here.
It's beautiful. How do you find Bali so far?
Actually, they've been working us nice and hard, but it's been really friendly and a lovely group of people. And as he said, it's been a really nice meeting.
Okay, so Dr. John, so you're practicing in Sydney. So could you explain more about that? What kind of patients do you see?
So I work in South Sydney, and Australia's a really big mix of people now, and I think a big chunk of what we do is still sort of skin cancer, but I've really sort of grown doing a bit more sort of scar work. So I love treating acne, but also treating acne scars, and that's sort of evolved that now we sort of treat burn scars, other things as well. And the big thing is no one likes getting older, so it's always nice to be able to do rejuvenation. But often a lot of what we're doing, we're just repairing the skin, making it more healthy. And luckily, healthy looking skin is often more youthful looking skin as well.
So what makes you interested in such cases, in acne scars, in rejuvenation, or in skin cancer? What attracts you?
And I think the really good part with dermatology, and unfortunately I've been a dermatologist quite a long time, it's really evolved all the things we can do. And I think, when I started out, we really just had vascular laser and pulse dye laser, and all that was good to do, great to treat rosacea. There weren't that many treatment options. It was a painful procedure. But now, things are evolving very quickly, and I think the exciting bit is, you can blend the lasers, but
exactly right.
One of the biggest things now, that laser-assisted drug delivery and working from the outside of the skin inwards. But also, as you mentioned, with injectables, we can work from the inside out as well. So I think now, it's a lot more holistic what we can do.
So the best thing is we can combine both. We can do it from outside in and inside out as well. How long have you played with lasers? How long are your experiences with lasers?
And I think I've been a dermatologist now for about just over 25 years. And luckily during our training, we did get exposure. But again, it was in the early days, it was just the pulse dye laser and the CO2 laser. And then I concentrated more on the medical side and of course skin cancer. But the last sort of 10 years I've been really getting back into doing more and more laser again.
That's great. What role do energy-based devices like lasers play a part in your practice today? Would you say it's something crucial or?
And I think the big thing in our practice, a lot of it's based around sort of treating skin problems, skin disease as well. And I think in Australia, we've got very harsh sunlight and a lot of sort of photo damage, and that contributes to a lot of conditions, be it melasma, with sort of the damage of the collagen layer, but also the extremes, you get that rosacea, redness, broken capillaries. And unfortunately in Australia, you also get lots of pre-cancerous skin changes or early skin cancerous changes, and that can present with those irritable spots, redness, brown spots, uneven and irritable skin as well.
I see. That's very interesting. That's very interesting because nobody, as you said, nobody likes to get old. So, and there are more and more treatments, more and more technologies. The more modalities that we can use to at least slow down aging. Yeah. So what kind of Alma platforms do you use in your practice, and what are your favorites?
Okay, well, we've got 2 Alma platforms, and as I said, we keep buying too many devices, but the first one we got was the Alma Hybrid device, and we've had that for over 4 years. And one of the first reasons I got it was because I really liked the idea. They've got this thing called the TED, or the transepidermal delivery device,
Yeah.
and I've done sort of also clinical pharmacology training and drug safety. And as I said, one of my favourite treatments before was a thing called photodynamic therapy. And the big trouble is photodynamic therapy, it was good, but never quite as effective as we would have liked. And the good part was a laser-assisted delivery of that. It's made it a lot more effective. And I suppose in Australia we use it for treating pre-cancerous changes, early cancerous changes. But as you sort of know, it's really good for treating acne, and it potentiates the skin's response to other devices too. So if you're treating acne scars, it can improve the response for those red scars. Improves your collagen response, and the best part, it also treats acne at the same time.
What makes it unique? I mean, like, there's a lot of similar machines, So what makes it unique? What makes this machine so indispensable to your clinic and to your practice?
Okay, and I think we've got 3 different sort of CO2 lasers, and although I've loved CO2, it's been the gold standard for treating bad scarring, bad sort of aging changes. They really sort of came with a lot of downtime, slow to heal.
Right.
You always had to talk people through that healing process, and for severe damage, or bad scarring, people would have 7 or 10 days being confined at home, and that might have been okay in the old days, but these days people can cope with 2 or 3 days for a strong treatment. But once you're getting beyond 3 days of town time, or putting your social life or work life on hold, that's really the limit there. And the hybrid's been really good because it preserves having the benefits of CO2, but it's blended, as you know, with the non-ablative, so you can have a really good response, but more rapid sort of healing. And I think the other big thing that's changed in dermatology is the technology of cosmeceuticals or creams and skincare. And I think it is really important now that you incorporate everything you learn into the treatment. So you prime the skin, and that might be with the retinoid, as we were talking before, a vitamin C, and definitely sort of good sun protection, sort of key for everything. But I think that does sort of help with that sort of your response, your healing response, and for reducing potentially complications there. But the other big thing with Alma Hybrid, those cosmeceuticals are really coming of age, and just really simple things like putting on vitamin C after your treatments can reduce the downtime, improve the collagen response, remove the removal of pigment. And anything that helps that healing also improves the safety. So if you've got prolonged healing period, that's when you might get infection, that's when you might get PIH, and all those things go wrong. So everything that helps things heal quickly, recover quickly, it's not only good for the patient, it means less troubles for you.
Less complaints.
More
happy patients and less complaints.
And the best part is, like, if someone has a big CO2 treatment before, that'd be sort of seen as a one-off thing or a really big thing to repeat. But now with sort of the low downtime, you're getting the same or similar sort of benefits, and hopefully with a lot of our improved technology, even better benefits. But people are happy to repeat it or do a series of treatments, and often you'll end up getting a much better result if you can do 3 treatments instead of one really strong one.
Right. So would you say that the Alma Hybrid, which combines the CO2 and the 1570, produces the same or even better result, but with much shorter downtime?
And I think, like, every laser is sort of different, but say for treating scars, I think it actually exceeds or does much better than the CO2 laser itself. And in Australia, unfortunately, as dermatologists, we cause a lot of our own scars that might be doing a biopsy, might be doing surgery. So one of our favourite uses of the Alma Hybrid is whenever we do any skin surgery, we bring them back week 2 and then 4 weeks after, and we do sort of a relatively gentle hybrid treatment that everything says treating a scar early, you're going to get better results and you don't have to treat as badly. And the good part, fractionated treatments, they trigger the skin to go to normal. So if there's too many capillaries, it remodels to be less red. If there's too much collagen, it'll soften those thickened scars. Too little, it'll thicken the collagen layer. And it's really good for pigmentation or evening out pigmentation.
Right.
And I think, although before you were scared with CO2, with the risk of causing PIH, the risk alone with Alma Hybrid's a lot lower, but now with sort of good skincare And we add things like tranexamic acid,
acid,
vitamin C afterwards, good barrier repair creams. We really don't see much PAH or very little, and it's usually only if something's gone wrong, and it's often sort of a patient factor, such as if something hasn't been cared for properly or the rare infection that might occur. So it's really sort of made it a lower threshold to do it because it is a much safer treatment.
Yeah, I agree with you. And the amazing thing about this machine is that it has such a short pulse duration, so you can have a lot of energy, and you can pack a lot of punch in just a very short duration. So it decreases the risk of PIH, especially in Asian patients. Where in Indonesia, we see our patients are mostly Fitzpatrick 4 and up, and those kind of patients. And so you need to pack a lot of more punch in a much shorter pulse duration to decrease the risk of PIH. So I read about this machine, and they have the impact technology. Can you explain more about that? And I don't see any other lasers have this impact technology.
And actually, that was probably the first thing that got my interest there, because, as you said, I love skincare, the evolution in skincare technology. And as you said, I like the idea of the laser-assisted drug delivery, where you have a laser, it will do a little hole in the skin, and the stratum corneum is a big barrier in the skin that stops things from getting in. And unfortunately, a lot of the things we want to get into the skin are water-soluble, or things like the vitamins, or sort of things like cortisone if we're treating a thickened scar. But also a lot of our peptides, growth factors there, and things like the polynucleotides, they're all nice and water-soluble. So you need those little holes, but unfortunately, although that really optimizes the uptake, we really want to sort of maximize it and do better. And the ultrasound's good in that it does this push-pull effect, which helps get them through the holes, but also, depending on the size of the little channels you've developed, it can go the full depth, be that sort of half a millimeter, and with Alma Hybrid, you can actually get up to 4 millimeters.
Oh, that's pretty deep.
Into the skin. And not only does it sort of get in, but the slight coagulation zone around it also sucks in those molecules to have a reservoir that sort of just slowly releases over the next few days. So I think the good part is you get really good delivery. With the benefits of the CO2, you've got this nice reservoir, so it's a sustained benefit, because before you thought, you put something there, it's just there for the day or a few hours. But
exactly.
The combination of the two.
Having a reservoir is a very good tool to have. What would your recommended session would look like? I mean, like if a patient comes with an acne scar, what kind of treatments would you do? I mean, would you do the lasers, like the CO2 or the 1570 afterwards, or would you blend them, or would you do the impact afterwards? How it would look like if, let's say, a patient comes to you and then, I have an acne scar, doctor, please fix this.
Okay, and I think as a dermatologist, we always like going back to the skincare there. So I think one of our favourite things, as we mentioned before, is the retinoids, and you can't really go past retinoids for being sort of good to control acne, to stop any new scars there. But it's really good that for tretinoin and sort of the newer ones such as Acleaf or trifarotene, there's good evidence they alone actually can help with remodelling and improving acne scars. And I think it's really good to prime the skin before you do any sort of treatments there, because it's good to see they're good with their skincare. And my favourite reason for using retinoids is people have to be good at using sunscreen as well, and it's always a good thing.
It's a good thing.
So it's good preparation and good discipline before laser. But if they've got some acne and active acne, in Australia we can use isotretinoin, but here I understand it's a bit different, but I think it's really good to have them on the retinoids. And then with the Alma Hybrid, you've got the option of doing the non-ablative laser alone. And that's really good to settle down those inflammatory lesions that the chromophores water with the non-ablative erbium glass laser, but that overlaps fairly closely with the sebaceous gland as well. And the good part with this device, it's quite a powerful non-ablative laser that can go 1.2 millimeters or deeper into the skin. And that's really getting to the depths of oil gland to shrink it down. Because everyone hates large pores. They definitely hate acne. So it's sort of good that you can treat the active acne and you can start treating the scars. And with acne, if you've got those, what we call post-inflammatory erythema, or those red sort of lesions before. We used to think that was just inflammatory and active acne, but often, actually, as you know, you can have active scars, and that redness can warn that you've got collagenases, other things that are damaging the extracellular matrix, and that redness often warns you're about to get those atrophic scars or those soft rolling scars. So I think it's really nice to be able to start early while you're controlling their acne. And then again, it's always nice, you don't want to start with the strongest treatments in patients, so it's good to have the option where you can do a gentle non-ablative treatment, and then if they do have sort of ice pick scars, the boxcar scars, or more severe scarring, that's when it's really nice to blend in some CO2 laser as well. And as you said, that then gives you the power of really getting all the cosmeceuticals into the skin for repair afterwards.
Right. How about the impact? Do you do it after the session, immediately after, or?
And when you sort of do laser, and the good part with CO2, the channels are open for a while, but you're going to get that maximum delivery in that first sort of 30 minutes after the treatment. So it's really good that as soon as you've done the laser treatment, that's when you start doing the delivery using the impact, and that's when you're going to maximise those benefits. But again, although they heal quite quickly over the next 24 to 48 hours, depending on the size of the channels, the stratum corneum's not going to be quite as thick and not as quite as impenetrable. So it's actually really good if you can, and if you're not doing a really aggressive treatment, you can continue things like the vitamin C and that in the subsequent days to enhance your response and help reduce complications as well.
So I read about this, the mix of ablative and non-ablative. So I presume that by combining this ablative and non-ablative, like let's say I have a CO2, like any other normal CO2. If I see a darker patient, Sp.DVE 5, 4, 5, 6, I would probably decrease the density and decrease the power. But here I see that not just decreasing the density, but quote unquote replacing those density with non-ablative, so we can mix those and be safer in darker skin. What do you think about that?
And I must admit, sort of when I first got the Alma Hybrid, I thought this is a CO2 laser. It's going to have the same risks of causing post-inflammatory pigmentation. And I confess, when you're treating bad scarring, if they've got bad acne scarring, burn scars or surgical ones, you do need the CO2. So I thought, I've got all the other tools to fix PIH if it happens. So we've got a pico laser. So I thought, I'm still going to do my CO2 lasers where I think it's right. But I think, as you're sort of implying there, it was a nice surprise that the risk of PIH is a lot lower just because of that combination of CO2 and the non-ablative. And I think also, as you were saying, with a lot of sort of lasers, you don't get to choose the pulse duration or how long the pulses are. That most devices, you put up the energy, the pulse duration will increase, whereas on this device, you can choose your pulse duration to keep it in that safe range as well. So I thought it's really good that although it's very flexible, you also can be completely in control. But
the pulse duration as well, and the energy.
But the good part, it does have some good guides to begin with, so it's safe from the beginning, but it's nice that when you get to know it, you can really sort of tailor things there. So I thought the nice surprise is you can do a solid, strong treatment, but because of that blending and that mix, it's been a lot lower. And I also think having had that TED or that impact handpiece, it makes you really aware of thinking, now what can I put on after laser to improve the outcomes and prevent problems, and it just makes you apply all your sort of knowledge there to prevent troubles and improve things. So one of our favourite things to do after treating acne scars is to put on short-acting insulin.
Oh, that's very interesting.
And it sounds like it's become a very common thing to do in Australia, I suppose, just because we speak to each other there. But it was based on some studies coming out of India where they put CO2 laser on both sides, but on one side they did platelet-rich plasma, which has good evidence to speed healing, and on the other side, short-acting insulin. And the side with the short-acting insulin healed faster and had a much better collagen and acne scar response. So
that's very interesting.
And then it made us think, now why is this? And they used it because of the insulin-like growth factor effect. But insulin, as you said, you put those channels there, it's water soluble, it gets in, it stimulates new collagen production, it encourages your fibroblasts to proliferate to make more, it also increases hyaluronic acid, it speeds the healing of the skin on the surface, And it also increases all the things that are good for the skin moisture, which is also good for healthy skin and nice functioning skin. And there's also evidence it does reduce that melanosome production.
Oh, wow.
So
It decreases pH as well.
Yeah, so I'm pretty sure since we've been doing that, pH hasn't been an issue, but we still, now we actually do it for everyone, but before just anyone with olive skin would add tranexamic acid over the top too, just to be sure. And the other thing that we'll do sort of routinely, once that's been absorbed, is put on the C-ferulic acid or vitamin C. And although there's other things you can do, such as exosomes, I'm a little bit cautious because the impact has done a great job there, but if you were to do that ultrasound over the exosomes, they're really, really fragile. You're probably going to be wasting your money because it'll damage those exosomes and they won't be as effective.
Right.
But if you really want to use them, they're good to give them to the patient to take home and put on each day to help with the healing afterwards.
How would you say that the impact technology increases the absorption rate of the drug? How would you say, like, compared to just doing CO2 and then putting something on top of it?
And I think it's really good when you've got patients that sort of tell you the difference. So in Australia, we've got quite a few patients in Sydney who were involved in the White Island volcano disaster in New Zealand, and they've had really bad sort of scarring over large chunks of their body. And they've had many sort of laser treatments before through the hospital system. And in our hospital, they just had the ultra pulse CO2 laser.
Oh, yeah.
And it was interesting that you have a patient, they come in expecting to have the same type of recovery, the same type of downtime as with the ultra pulse. But you know, the first bit when we use the hybrid, you do that blend of the CO2 and then through the same hole, the non-ablative. So you're getting that really great depth, like the ultra pulse, you can go down to 4 millimeters. But because it doesn't involve a really long pulse duration, as you mentioned, you're not getting quite as much of that heating that slows healing, causes the pain, and causes that redness. And then, as you said, we put on the same sort of things as they did in the hospital with the combination of triamcinolone and also some 5-fluorouracil. And of course, with the hybrid, you add in the impact to really get it deep in the channels and a larger amount. And when you talk to the patients with the recovery, at first they sort of thought, oh, I've recovered much more quickly and haven't had the same degree of ooze, haven't had to worry about bandaging up as much. And they just thought, oh, this isn't going to work as well. But they end up getting actually much better contraction release as well. So I think that delivery is actually real. It does increase there. And I think the good part is it really does show that combination of CO2 and non-ablative does also reduce the downtime and discomfort. So it was a nice sort of confirmation, because for burn scar, the ultrapulse had always been the standard treatment before.
Just like earlier this afternoon that we saw with the patient with the acne scars, where we did pretty aggressive treatment. We cranked it up 30 watts, and then afterwards we put some the growth factors, and the swelling immediately decreases. I mean, like, it was jarring. It was pretty mind blowing. I was like, oh wow! I mean, like, the swell is not there. I mean, like, the erythema is gone. The swell is not so bad. And it's in the span of a few minutes, right? I'm like maybe 10 or 15 minutes.
And I think the other bit, I think you're lucky here in Indonesia that I think Asian skin, it is sort of thicker. It's less damaged. It's a bit more resilient. So it's actually sort of nice when we treated 3 patients in a row. As you said, you look at them and you think they're going to recover so quickly, because I think your skin's not as sun damaged, and although you've got a lot of sun, we've got more of a hole in our ozone layer. So I think, as you said, it's nice, because I think although you do see that quick recovery, and you do see over the next few days, I think people heal a lot quicker. I think here, hopefully, your recovery is even faster again.
What would you say the other indications are? I mean, I know that the Alma Hybrid is very good for acne scars and for post-surgical scars, hypertrophic scars. But other than scars, what would you use it for?
Okay, so I mentioned sort of a big chunk of what we do is to make our photodynamic therapy better for PDT, and that was the big reason I bought the device. But although that's a big chunk we use it for, the other things we do are sort of growing, and I think. And I thought I'll go back a little bit to the acne scarring, because that sort of overlaps with things, but it's with that pigmentation, that fractional layers is a really good for evening out pigmentation. And I think today we saw, if you did too much Q-switch laser, you got risk of that mottled pigmentation there. And I think the fractionated lasers, either the non-ablative and CO2, are really great for evening out that pigmentation. Again, I would have been really sort of scared before with the CO2 that you're going to have risk of PIH, but again, with everything you can do to help with the healing, it's a good one for treating those sort of mottled hypopigmented sort of scars or conditions. And a bit scared doing it in vitiligo, especially if it's active, but for most other conditions where you might have had hypopigmentation due to other skin diseases, it can be useful for getting the pigment back. But I think the other big thing is sort of photo rejuvenation, and I think even in Indonesia, although you've got nice olive skin, you do see lots of lentigo, you do see the seborrheic keratoses, and I think the good part with this device, you can quite gently target those age spots and just wipe off a layer at a time, and then do a gentle field treatment. So it is a good one for that. And again, although I talked about insulin for helping with repair of acne scars, it's also very good for fine lines and wrinkles. And in Australia, people often do, especially around the eyes, around the mouth, get a lot of trouble with sort of the wrinkles and photo aging of the dermis. And adding that insulin means that you can do a relatively gentle laser treatment, add those actives, impact them in, and you can get really quite a good collagen response as well.
How often would you do the laser? Would you do it monthly, or would you do it?
And I suppose we always find sort of 3 is a nice sort of cycle to do, and although sort of try to aim to do it sort of 4 to 8 weekly, it always has to fit in with the patient sort of things there. So it's often between 4 to 12 weeks seems to be a nice sort of space where you're going to get a nice response, and it's going to add on to what you've done before, because you're in that nice healing phase where it seems like the skin responds best within that sort of window between sort of 2 and 12 weeks after your previous treatment. So we always try and encourage them to do something in that time frame. But again, you've also got other options. I think we were talking before about the soprano titanium, and we've got the special edition there, and often it's really nice to get people back. They might not want a bigger treatment, they might have a weekend of downtime, but it's really nice for us to get them back to the clinic, see how they've gone, and you want to make them sort of part of, used to coming back to see your clinic with what to do next. And something like that's a really nice way to sort of have a very low downtime, not uncomfortable treatment. And as you said, we were talking about the titanium lift, where you use lower energies, multiple passes to heat the dermis to get that contraction and that new collagen response as well. So something like that can work in really well as well.
Right. How would you say for melasma? So I heard people say that so melasma is not actually a pigmentation problem. I mean, a small part of it, yes, but it's not merely a pigmentation problem. It's also of a basal membrane. It's also a vascular problem. How would you say that this Alma Hybrid play a role in this in melasma?
And I think, today we had a really good session with laser, and it was nice to see a lot of people did cover melasma there, and it always says laser's not first line, that you've got to have the photo protection, the right sort of skin care, and a range of sort of medical agents to sort of help. But I do think over time lasers probably will get more and more important in its management, because I think now we're starting to understand a bit more about what drives it. And although not everyone's melasma is going to be the same, it does look like, as you implying there, that the basement membrane is really critical. That in people with melasma, it has been damaged, it's leaky, they've got melanocytes sort of crossing it there, you're getting the melanophages and other bits in the dermis. And there's a lot of evidence that the collagen layer is where a lot of the action happens too. As you said, you've got damage to the collagen, elastin fibers, the whole environment for the fibroblasts and other cells. It's pro-inflammatory, and it's that constellation of that sun damage there, that inflammation, the vascular activity, the mast cells, that broken basement membrane zone that seems to contribute and make it more resistant to treatment. So I do think if you're going to do treatments, although I suppose the Pico and Q-switch lasers have low downtime, do sort of work, I think to really sort of get that longer term improved control of the skin, I think fractionated treatments are really valuable. And I like the way that with these fractionated ones, you're gently repairing that basement membrane zone that seems really critical.
Right.
But you're also, the papillary dermis and upper dermis is where melasma really seems to happen, and that's where these devices can work really well for that repair. And I think, again, you don't want to do an aggressive treatment. Melasma is all about gentle repair.
Exactly.
And that's where I think it is nice to do a little bit of CO2, because then you've got that laser-assisted drug delivery for some key things like the tranexamic acid, and that helps reduce the pigment by blocking the actions of plasmin. It also helps preserve and help the repair of that basement membrane zone. And it also seems to have a really good collagen and normalizing effect on the vasculature. But I think everything's sort of saying the fractionated lasers at low energy, low density, and using that laser-assisted drug delivery to do all the actives seems to be, you know, a really promising future for treating this condition.
I agree with you. So a lot of people maybe miss the point of melasma, that you actually have to treat the basement membrane, the basal membrane. So people, if they think of melasma, they always think about pigment lasers. They always think those picos, those nano lasers, those 755, those NDX and everything, which is not wrong, which is absolutely right. But you still have to remember about the basement membrane. So this is where the Alma Hybrid, this is where the CO2, this is the 15, 17 nanometers play a role in melasma. People will probably say, why would you use 10, 1600 melasma? This is where it goes, repairing it.
But I think, as you were saying, you've got to have a really short pulse duration.
Exactly.
You want to avoid that heating. And you want to normalize and repair. And it's nice that, I think, it is good advice to doing things gently as well as being powerful when you need it.
So this is one of the, this is very versatile. I mean, you told me that you can use it for acne, active acne. It reduces the sebaceous gland. You can use it for acne scars. Acne scars, there are two types of acne scars, atrophic and hypertrophic acne scars. You can use it for general rejuvenation, fine lines, wrinkles, melasma. So this is a very versatile machine. So would you say in your practice, do you have any machine that is more versatile than this?
Actually, I'm trying to think. Definitely, like before, I think vascular laser was our number one thing by far, and I suppose that was safety, convenience, and also that. But I think actually now with new technologies, the ablative lasers just have that power to really repair the skin and normalize. And I think fractionation really was transformative in the laser world, and that was invented and developed quite a long time ago by Rox Anderson and their team. I think it's sort of exciting. Since then, we've only really had incremental steps. There hasn't been anything quite as revolutionary. But I think, as you said, the transepidermal sort of drug delivery and the TED and the impact's probably been one of the next things to sort of learn, that not only are we doing that normalization of the skin through fractionation, we can really sort of target what we're doing, improve the repair, improve sort of treating conditions. But I think, it's only just the beginning that you sort of, every meeting you go to, you hear about all the new things you can apply to the skin or inject into the skin, with the exosomes, the secretosomes,
the growth factors.
We sort of know with all the vitamins there, but, all the growth factors and genetic engineering, I think, it's actually going to be really exciting what the next steps are, and it's good to have a device where we're going to be ready to actually deliver them to the skin.
Other than aesthetic dermatology, so this Alma Hybrid is also using it for general dermatology or skin cancer as well. So you do surgery with the Alma Hybrid. How does it compare to other modalities?
Because I think in the old days, with sort of a surgical scar, the fractionated CO2 laser was sort of the gold standard. But again, as you said, it's a nice big treatment to do. There's significant downtime. It's a more painful treatment to do. And it does look like, when, at least with the studies there, and there's always room for more studies, it looks like, especially when you're treating early, that combination of CO2 and non-ablative, relatively low density, and again, relatively low power, it just helps normalize that healing response at the right time. So I think it's become just a routine thing. So if we're doing cancer surgery on the face or a visible area, we'll just sort of normally do it as part of our skin cancer management.
Right.
And again, even if you're doing a biopsy on the nose of a young person, they're not going to cope well with a scar. So it has become a part of that there. And I think you probably don't do quite as much surgery in Indonesia.
We don't have a lot of skin cancers.
But I think, people don't like a whole lot of sort of lesions, and I suppose it's that fear of leaving a scar afterwards.
Right.
I think it's nice if you've got a device like this, it improves your confidence to do things because you can help prevent and I suppose also fix the scar if you've done a bad job.
Right. That's right. So, before doing this, I was pretty familiar with other CO2 machines and like with other CO2 machines, I don't have the confidence to raise the power that much. And in this machine, you can crank up the power because you have so much control. You have control for the pulsation, of the energy, of the density, even over the blending, even so much control. So it makes it a lot safer. So how would you say to maybe a lot of practitioners here who has experiences with lasers, they would probably say, I already have a CO2 machine. Why do I need another one? What makes this different than another one? So you told me that you have 3 other CO2 machines, yet you still got this Alma Hybrid. Please tell me why and how.
And I think the other bit that's sort of nice, it's got this really good cooling ring around it. So it sort of, you do the pressure there, that coolness distracts the patient you're sort of treating. So that's been a really nice addition as well. Right. But I think also, just because of its flexibility, before lasers wouldn't have as many choices to design how you're going to treat things. And I think it's nice that you can really plan the treatment with acne scars. So if you've got the ice pick scars or the box scars, you're going to sort of target them differently, that you're going to do the rolling scars. And often, as I said, the patient's going to also have some hypertrophic scarring. And it sort of allows you to do multiple passes to target the different things. And I think with the rolling scars, although CO2 is really good because you want to tighten the skin and there's been a lot of atrophy, you want new collagen there. The non-ablative lasers, really good for also producing more collagen, but it's even better for producing elastin and giving the skin its elasticity back. So not only are you getting the same benefits of having the CO2, but you're getting a more natural response. And I think everything we're trying to do is bring the skin back to what it was before. And I suppose there's always the argument with pure CO2, are you replacing some type of scars with a different sort of type of scar? And that's where I think sort of more power, wider are things not always the answers. That's where I like a short pulse width and that option to still go deep where you need, but to be able to blend it there for that more natural response there.
So you mentioned elastin there, which is very interesting because a lot of people say collagen, like injecting this induces collagen, lasering this induces collagen. But a lot of people forget about elastin. Collagen, scar is also a collagen, right? So what we want is collagen and elastin. You want that elasticity, not only the collagen. So this machine does help with both collagen and elastin, unlike traditional or other CO2s in the market.
And I think the other big thing is like CO2, it's become a lot more popular in Australia now too. And it is devices like the Alma Hybrid that has really changed that, because people, they do have really high expectations. They want to see a clear difference. And I think in Australia, our patients don't necessarily want to come back every week or two. They'd like to do sort of bigger treatments and see a clear difference from a few treatments. And that's where CO2 has become really popular. But I think with the hybrid, it's just changed the threshold even more, because it means you can do a good effective treatment, but with a relatively short downtime, not the same discomfort involved. And people are more likely to sign up for a series of treatments, which makes me more comfortable because I know I'm going to get a better outcome. And also, if you do sort of a solid treatment, but not the really strong treatments, they're going to heal quickly and have less potential problems. And as you said, it's all about trying to do no harm in dermatology. And the shorter the healing period, the shorter the downtime, the safer it is for everyone.
Right. That's amazing. So can you tell us more about the cases that you've handled? How does this machine, how does this treatment, how does this combining this treatment transform the lives of your patient and makes you a happier doctor?
And I think, as I sort of mentioned there before, like I've got some patients where you've either managed their acne scarring and have known them for more than a decade and that, and unfortunately acne scars age more than normal skin. They photo age more.
They look older
They
than
haven't
they
got
actually are.
resilience. So where in the past you did a strong CO2 laser treatment, it was a big thing to do, a long recovery. It's nice to be able to introduce them to the Alma Hybrid, because then they realise, oh, I can still get a lot of those benefits, but it's a lot easier to do, not as painful, and the big thing, not as much downtime, a faster recovery. But I think, as you said, it still means that they're getting a really good response, but the patterning dissipates and settles really sort of quickly. And I think the big thing is we've also got better over the years. That I think it's nice that not only we've been talking about putting things on the skin and through the skin, it's also nice to be able to work from the inside out. And I think it's nice if you can, before you're doing this treatment, to talk about, say, a skin booster or biostimulatory one. And if someone has that bad acne scarring, that's when it's really nice to do subcision as you put in the biostimulatory fillers. And I think that really primes the skin well. You've broken the adhesion, so when you do the laser, you're going to get better contraction. I suppose I do the subcision with an 18 gauge cannula. So hopefully it's just micro trauma, and that micro trauma also seems to give you a good collagen response as well. So I suppose we've hopefully learnt how to do things smarter and to stage things. And you know, in the old days, you'd try and do everything in the one session, spend a few hours with the patient. But you know, people, as long as it's a nicer experience, which it is now, they're happier to come back, and you can do it over a few sort of sessions instead, and it makes it safer and better. And I think it does improve outcomes as well.
Would you do it? Would you do it the injections or the injectables or the substitution? Would you do it before or after the laser?
And I think if I will sort of recommend to people to do them beforehand, and you probably want to do it around a few weeks beforehand. But again, the window and timing, I like to do that sort of 3 to probably 8 weeks if I can for the biostimulation, because that's often where a lot of the products will have their peak benefits. And I think if you're going to get a better response there, better integration. And there's also a feeling that when you do that first, then do the laser, and it might be a biostimulatory hyaluronic acid, you seem to get a more permanent improvement in collagen, whereas in the past, we used to think the HAs would sort of go down after 12 or 18 months. You see patients where you've done that, and 2-3 years later, they've still maintained that filling and loss, the replacement of that loss of atrophy of collagen and of the fat layer. So I think doing that biostimulatory filler and the laser together, we are actually probably permanently changing the skin in a better way. Whereas before, I think you do the laser, then an HA filler, it would go down, and then you'd have to replace it again. Whereas I think it's really nice with our new products. I think doing it first is the way to go.
So it's very interesting that you mentioned earlier that patients with acne scars age a lot faster than those who doesn't have. So would you say, so people with acne scars, so for example, I have a few patients with acne scars, so they're now in their 50s or in their 40s, and 20 years ago when they have acne, when they were still teenagers, there's not a lot of technology back there, there's not a lot of options, not a lot of treatments available, and they still want to do it, after 20 years or something, they want to do it, they now feel that they want to get it done, they get annoyed by it. So how would you say how would Alma Hybrid play a role in this? And especially when you're 40 and 50, they want general rejuvenation as well, not just the acne scars. They want those fine lines gone. They want all those wrinkles gone. So can this machine help with all those things at the same time?
And I think that's one thing I've really sort of noticed coming to Indonesia. Acne scarring is actually remarkably common, and it can be quite severe. So it must be a mixture of sort of factors there. And unfortunately, as you sort of say, as you get older, the acne scars worsen, and you'll feel even older than your friends and colleagues. And I think, unfortunately, when you've got significant acne scarring and that photo aging, something like fractionated pico lasers going to be helpful, but it's not going to make the same difference, as you said. And I think that's where the power of CO2 is great. And as you said, I like the idea that we can blend, get deep, be able to get to the depths of the scars where we want to, but then you can do that full field rejuvenation treatment. And I think, as you said, in our practice, although we've got the pico laser, we've got radio frequency microneedling, we've got micro-focused ultrasound, we've got monopolar sort of radio frequency in that there. The CO2 and ablative lasers have become a more popular sort of choice because they've become safer, they've preserved their effectiveness there, and people's expectations just keep increasing and increasing. So I love having my pico for fixing problems and treating sort of other sort of pigment problems, but as you said, I'll often give patients a choice of a milder treatment, a moderate treatment, or the full one there. And I think the nice way, the hybrid offers you that moderate and also the strong option. And often people do choose that in the middle sort of one. They want something effective, but they aren't prepared for that big downtime anymore.
Right.
So I thought it fits in a nice space for a lot of patients.
So I heard about this Alma machine. They have this thing called the lunchtime rejuvenation. Can you tell me more about that?
Okay. And I suppose in Australia, we're under a lot of pressure to never do anything inducement or minimise a treatment. So we're not allowed to actually advertise a lunchtime one. But I think as it implies, you want something where you can have a treatment over lunch, and when you return to your friends or the office, you might just have a bit of redness or a bit of dryness or something you can cover up. And I think, as he said, you can have a good strength of the non-ablative laser done for your collagen, skin tightening, and then you can do a nice gentle CO2, and then you've got the power of putting those growth factors in and that they have it calm down. So as he said, you can really sort of return with just a bit of redness, a bit of dry skin. And again, although you've had an ablative laser, you haven't got the trouble with the weeping, crusting or blood that we would have associated before with the treatment. And it is just so tailorable, a nice low density one. You're still optimizing the absorption of all the things you want to get into skin with the vitamin C, the retinoids and other bits. So, I think it's good that the laser peel, it has become a real reality that in our practice, we don't do many chemical peels anymore. We're more likely to do a micro laser peel these days.
I think that's what makes this great. Like you can be so aggressive. You can do severe acne scars. You can do surgeries. You can do skin cancers with this one, and yet you can still use this machine as a peeling. As a laser peel, as a lunchtime rejuvenation. People who doesn't have a lot of time. People who have really short lunch breaks maybe, and you can still use this machine for aggressive treatments and for more gentle treatments as well. Can you share some of your cases about this machine? So, what is the favorite thing about let's put it this way. What would a patient ask you for this machine? Would they come back and ask you more, doctor, what is the last laser you laser me with? I want that laser again. Or what kind of treatments you use that makes patient want to come back?
And I think, as you said, Andrew, that often we have a lot of sort of gentle treatments. We want to sort of minimise the downtime, but unfortunately sometimes that does minimise the benefits. And I think the good part in our clinic, we've got dermal therapists, we've got nurses who do a lot of treatments, and you'll start with sort of things a bit more gently, the radio frequency, maybe a series of peels, and the patients come back and they said, I'm really happy with what you've done, but I just want sort of more. And I think the good part is, for all our team, where people have watched the difference there, it really is that nice sort of next step for treatment things, because you are going to have people are going to come back and they're going to be able to see a clear difference in their photographs, and people are going to sort of notice that improved collagen, that glow, and that. And I think it's good to be able to have that treatment where before there was a big threshold before you do ablative laser, and now from our front desk to all our staff, it's become sort of that nice sort of mild plus treatment right through to moderate. And then unfortunately, if you have people with terrible scarring, we still have to go a bit firmer, but again, nothing like before.
So we mentioned a lot about downtime and how this machine has a very low downtime with a good result, with comparable results with machines that have a longer downtime, like which is good. But how would you say for the skincare routine for the patients? Would you stop retinoids before the laser, or when would you start again the retinoids, or the moisturizers, or the retinols, or the azelaic acid, niacinamide, or whatnot? How short how short would you stop it, and how will you start it? When will you start it, and when will you stop it?
And I think that's where there's quite a big difference between what's written in the literature and I think what people do in common practice. And for a lot of my patients, I've started them on long-term retinoids, and if someone's been tolerating a retinoid and been using it regularly, there's really good evidence, at least clinically, is that you continue the retinoid right up to the day of treatment.
Right up to the day. Okay.
And I suppose if you've done a gentler treatment, like a laser peel, I might start the retinoid from day 3, day 4. But if you've done an acne scarring treatment, often it'll be more like day 7 or day 10 before restarting. But I think we've learnt from isotretinoin, which I still understand you don't have here, but low dose is really effective for improving collagen repair, speeding healing. It really helps with a whole lot of things and reducing risk of PIH, whereas a really high dose of retinoids can slow healing. And again, how we use isotretinoin now is a really low dose, and I think it's the same looking at topical retinoids. We used to have the 0.1% tretinoin, but now it's more the 0.025 or 0.05%. And I think that really fits into that low dose one. So I think you want to continue it as much as you can and start as early as you can, as long as you're not getting that irritation. And I think the other really good thing is our skincare has really changed over the years. Before, when I started dermatology, we were told to use things simple like aqueous cream, and it had things like sodium lauryl sulfate that damage the skin. But now there's lots of things that say if you've got a nice wash and cream which has ceramides, a bit of glycerine, a bit of niacinamide, some free fatty acids, some of the essential ones there, a bit of cholesterol, all those things help maintain your skin barrier, but they also improve your tolerance of retinoids, and they speed your healing. So I think
use more aggressive retinoids.
Yeah, so I think all what we were taught, from what was written in the literature 20 years ago, it doesn't hold. But if you talk to a lot of dermatologists, they'll still stop it, days before and not start it up for a few weeks later. But I think, technology's changed, and what was common practice 20 years ago shouldn't be practiced now.
So we're talking a lot about the face and the neck. Let's talk more about off the face and off the neck. Like, how about using this for scars, for post-surgical scars, for cesarean C-section scars? How about using it for stretch marks? So I've been told that this, you mentioned a lot about collagen and elastin, which plays a huge role in stretch marks, and which has become also a lot of problems for both men and women. So how does this machine play a role in those
and I think
things?
as you said, like in Australia, people go through those abdominoplasties and other things, and then they have a bad surgical scars, PIH and things there. And I think that is actually a really good group of people to help.
Yeah.
And again, I do think of stretch marks, they really are, as you mentioned, a form of scarring there. And again, before, although CO2 was our best standard for treating scars, you had that hesitation because slow healing, prolonged erythema, that risk of PIH. But depending on the scar, actually we will have a low threshold to go to something like the Alma Hybrid nice and early on. Right. It is good if you're doing the stretch marks, as you mentioned. It's really good to include lots of the non-ablative laser to get that elastin back in that area, but there's nothing better than the CO2 to help with remodeling. And for those scars, that's where you would really turn down the pulse duration, as you mentioned.
Right.
And they're not, and say for stretch marks, you don't need to go deeply into the skin. And I think, as you said, with that assisted delivery of things, often it is nice to be able to address PIH with that mixture of the vitamin C, the tranexamic acid, and we also add in a bit of insulin too, because I think that does help there. But again, where before I would have been scared this is going to cause some PIH, it actually improves PIH as long as you don't do a higher density or too high an energy. You're actually going to address a lot of the concerns there. And unfortunately, sometimes with the surgical scars, if they've come early, again, you can go really nice and gently. you can make sure they get a really good result. So it's nice to communicate with your plastic surgery friends.
Right.
But once you've got the established scars, you've got to go a little bit harder. And I suppose that's where you really want to start early.
So a lot of my patients, especially younger women who's in their first pregnancy, the first time they know they're pregnant, the one thing on their mind is that how do I prevent stretch marks? So with this logic, by having a better collagen, by having a better elastin, does this machine help to prevent stretch marks?
Well, yeah, that's probably a really nice question. It'd be really good to do. So I suppose if you had a family where you think they're going to be at really high risk, that might be something you could think about, because as we sort of showed earlier today, if you've got planned surgery, if you do a gentle non-ablative laser with the hybrid laser before surgery, you actually get a much better healing response and a much better scar. And they've done sort of left-right controls where the treated side does clearly better. So I do actually think you could prime the skin there. I'm not sure about how organised most people are that to do things. And in Australia, laser's not recommended during pregnancy, though there's definitely no proven risks there. But actually, it probably would be a good option in those at high risk. And again, before someone's having their first child, get stretch marks, you might not be inclined to treat them knowing that they're planning 2 or 3 children. Whereas, it is a low downtime laser, you're priming, repairing the skin. Maybe we should be treating it each pregnancy or before.
So this is another method. Not just treating the scars, not just treating the skin, but also trying to prevent it. We're trying to collagen banking, so to speak. So can you share some of your patients' feedback and satisfaction? So do your patients come back, Doc, I want the last laser you gave me. I want that laser again. Or maybe you have some patients who are like, I've had very, very severe acne scars, and now I'm much more confident, and my acne scars are now 80% gone. And can you share some of those heartwarming stories with us?
Oh, and I think, as you said, the big thing is also when you've had people, they've had more gentle laser treatments, they get initially a nice response, but the pigment lesions come back afterwards. I think that's really good, where you've got a device that's going to have a better reparative thing, a much more effective treatment. And unfortunately, we do sort of continue to age. But I think, as you sort of said, I've had a few patients that I've known for most of my dermatology career, and unfortunately, a few of them did have terrible, terrible acne scarring. And I've had ones where, you've started with, actually, I had an erbium before my first CO2, so erbium, then CO2 laser, and then evolution within those for treating her acne scars, and that was during her sort of teenage, early 20 years. But then every time I get a new laser, I've invited her back to help and try it out, and it's really nice. Once we did the hybrid, suddenly she said, I was nice and tough before. I think I've got softer with some of the other lasers there. And then when it came to hybrid, she said, actually, I'm happy to keep coming back there. And I think it's nice that she's just sort of, the time before last, it was just before she got married. And unfortunately, it was during COVID, so she didn't get to see the parents-in-law. So we then did another treatment before she went to see the parents-in-law. And then I think she's signed up for another one. But as you said, it's usually before something important in life when she wants to come back now, because, as you said, acne, it's bad, the scars are lasting, and although they've improved a lot, they're there for life, and we can never get the skin to 100%, so it is a lifelong thing.
Right. So how does the aesthetic trends like in Australia? I mean, like, what are the trending treatments, and what are patients asking? And how does this treatment, how do you combine this treatment? How do you use this machine to fit into the aesthetic trends in Australia recently in 2025?
I think, sort of, as you said, things do trend a lot, and it's really weird, the timing of this now, that it's really been the last 3 months in our social media that CO2 really has been trending again.
Right, I saw.
People, they used to see it as a strong treatment, but now it can be a pre-rejuvenation one, a preventative treatment, but prevention and correction. And then, as you said, as people need it when they get older, it has that stronger thing there. But I think the big thing that has also changed, that fillers, partly due to social media and some sort of other sort of concerns regarding safety, they've really sort of come down. Whereas, the boosters or biostimulants are still sort of popular, and it's a great concept, and definitely something I've always sort of loved. And I think that pairs really well with these treatments. So as mentioned, if you can do biostimulation into the skin to prime the skin before doing a skin-directed treatment, that's become a nice popular combination. And again, we're very connected with Asia, and the polynucleotides, the PDRNs have become really popular. And again, they work well on their own for the really young people, but you have people when they get a bit older, they're really nice for that priming, and they can be very good before radio frequency. Love them in the periorbital area, but they're also a really good option for these stronger devices. And because they're so heat stable, depending on the settings done, you're not going to risk of destroying your polynucleotides either.
Right.
So it works in well.
So this machine complements that. So this works from outside in, and those injectables works from the inside out. And these two treatments complements it, especially for people, for older patients who needs it, who needs a little bit more
and
combined treatments.
That's where things are changing. That I think people are doing things younger and younger, and potentially what we would have thought were strong treatments before. But as you said, it's nice that strong treatments are again sort of gentle.
Right.
And I think the big thing, we're fortunate in Australia, we're one of the longest living countries in the world, and we age a lot more, so we look older than we feel. And I think it's good countries like Indonesia, your population getting older as well, so they're all going to have the same troubles as us. They want to stay young.
They want to stay young, definitely.
They want to look like they feel.
Definitely. So I think the time's running tight, so probably we're gonna have to wrap this up. So we've been having a very good discussion, it's very good insight with my very dear good friend, Dr. Sullivan. We've been talking for about an hour-ish about the machine. So the Alma Hybrid is a 10600 SCO2 with a 1570 nanometer laser. So it's a water chromophore. So chromophore is water, and it has both ablative and non-ablative lasers with a very safe, very versatile machine with a lot of indications. And it has been very indispensable to Dr. Sullivan's practice and as well as mine. And thank you so much for your time, Dr. Sullivan. Is there anything else would you like to?
It's been a pleasure, and actually it's been really good coming to Bali in Indonesia for the meeting. That you always learn a lot from other people and other doctors, and every country does things a little bit differently, and it's nice to take home a few insights. So no, it's been really good coming. So thank you.
Thank you so much. I hope you enjoy Bali, and I hope you find another time to actually go on a proper holiday.
Okay, no, thank you very much.
Thank you, terima kasih banyak kepada Alma Lasers Indonesia, terima kasih banyak kepada Radian L Versa atau PT Red, dan terima kasih banyak juga kepada Hotel Sofitel yang udah nyediain kita tempat yang sangat bagus dan juga keren banget. Di belakang ada pantai, everything is so beautiful, everything is so perfect. Thank you so much for your time. Saya Dr. Andrew. Dan bersama Dr. John Sullivan, bids you farewell. Thank you so much dan selamat sore.
Thank you.